Hi, everyone. I'm Steve here again for our weekly interview with Dr. Nario. Thanks for being here, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, and you know that Dr. Nario is in Reno, Nevada. I'm up at the clinic a lot, and there's people coming from all over the country, all over the world, huh?
All over the world.
Yeah,
You see
so
them.
it's in Reno, Nevada, Biointegrative Health Center if you want to learn more about them. So we're going to talk about statins. And you get a lot of opinions out there, a lot of people using them. So we're going to get the opinion from a biointegrative physician, which is you, Dr. Nario. So, what is a statin?
Well, Steve, it's one of the more famous medications that I always encounter in the clinical practice. And this is something that, of course, conventional doctors has also been using to, you will hear this, you've been eating a lot. Now you're having high cholesterol and blood tests because you have LDL, high triglycerides. They're now going to put you on a statin. I'm sure you've done that, been there, heard of it. So there is some sense to that. The thing here is we always kind of give statins a bad name, but the thing there is it's actually on studies, clinical studies, that it has actually the best clinical cardiovascular outcome in relation to even lowering down inflammation, oxidative stress, immune function in relation to the cardiovascular system. And it's always known to prevent that specific enzyme called HMG CoA reductase. A lot of jargon there, but that's the reason why it's effective for it to lower down, even prevent cholesterol to accumulate in our arteries.
Okay, so what um, what what are the benefits? I mean, I'm you know me. I mean, I'm in your clinic all the time. I'm not a medication guy. I don't take any. But what are the advantages or maybe benefits that, in your opinion, that there could be with a statin?
Well, Steve, there's really a lot. I mean, I just want to get the word out there that statins are not bad. In the integrative world, everybody wants to avoid statins, but there's a time and place for it. And again, there are numerous clinical evidences that it does help. So this is just me giving the facts so that people can understand that, oh, all right, it's not really a foe, but it's also an ally if used the right way. So statins actually, here's the biggest caveat here, has been proven to at least lower down the incidence of heart attacks 50%, and also risks of strokes. So as you can see, though both are lower down 50, even more, 54% to be specific for the heart attacks and 51 for the stroke. So why not take that, right? If you're going to be saved from these specific problems, and also it prevents further complications from these conditions in relation to cardiovascular problems. So if you really want to see physical changes in the plaque that is in an artery, it will be the statins that will lower that size of that plaque and even lower down the core of that specific lesion. So, and also if another physical evidence here, aneurysms, they shrink, especially in the thoracic area where these are always kind of showing up. It's also one of the medications that actually helps improve renal function and helps with blood pressures. It lowers down blood pressures, and it also reduces. Here's and I work in a cancer center. It's us actually lowering down cancer risks almost by 13 to 17%. So that's why it's basically part of what we kind of educate patients about when they have cancer. So as you can see here, it's not all bad. But the thing here is, it's not my first go-to. There are patients who I offer this because it's just so bad of a cardiac profile that they present to me. But again, another tool in our toolbox.
Okay, so you talked about it's not your first choice and so on, but so now let's get into some of the disadvantages or some of the negative things about statins.
Well, Steve, statins again. Anything has a good side and a bad side. So the bad side this is what we focus on in integrative medicine. So the most famous one really is the breakdown of muscle. So people who are on statins, you will hear a lot of muscle aches, muscle pains. These are very prominent when you take all these statins, and also when you actually lower down the blood lipids, you're now risking other organs that actually is dependent on cholesterol to lower down their function. When you talk about diabetes, it actually increases the diabetes risk of somebody who's taking statins, may it be diabetes 1 or diabetes 2. And there will be people out there who will be given statins to be told by their doctors, hey, this is something going that's going to be preventative for you. Actually, it's not. Somebody who's taking this for prevention is having an increased mortality in terms of getting an illness, cardiovascular illness, or whatever illness they couldn't get and die from it, in relation to, especially if you are over 75 years old. So it doesn't mean it's something that's going to prevent anything. Another one is memory loss. You have to remember our brains are made of fat cells. Deprive that from cholesterol through statins, memory loss is something also that you will be expecting. And also energy. As I told you, it breaks down muscle. So what do we use to move and exercise? Muscle. When you don't have that, then of course exercise is also and movement is affected. When I mentioned to you about brain, the brain is actually producing neurotransmitters. People on statins, more depression, more hostility. So it plays with your brains. It also increases cataracts by almost 27%. So that's really interesting. So as really, you can see here, it's not, I mean, there are different types of statins that can be more sensitive for other people than compared to other ones. But it's really something that it's different for everyone. And the thing here is, these are the most important things that I want to mention now to you guys. The depletion of nutrients that occurs with statins lowers CoQ10, vitamin A, vitamin D, vitamin E, vitamin K. So those four are what we call fat soluble vitamins. It lowers omega 3 fatty acids, lowers down also copper, zinc, creatine. So it creates a lot of nutrient deficiencies. So that's why, as you can see, the longer list of what I just said is more of the disadvantages rather than the advantages of statins. Thus, the reason why it's not my first go-to.
Okay, so let's now go to how you would treat a patient. Maybe you can explain when you would use a statin, and you kind of touched on that a little bit when somebody's got a just messed up uh,
Mhm.
cardiovascular panel.
Right.
So, how do you use these to help your patients or treat your patients?
Well, see, stance, as I told you, is something that can be in your toolbox. So that's something that I use, especially if a patient, for example, has very high cholesterols and, as you can see, diabetic, hypertensive. And they tell me, Doc, the holidays are coming. I really can't help it. This is going to be a long stretch for me. You know it's going to go downhill from here, right? So I use a statin. I offer them a statin, meaning I'm not going to give them the maximum dose. I always use low dose statins, and statins in combination with natural herbs and supplements, that also will be for another discussion, that they can combine to lower down cholesterol. So that's why this is something that, as we all know, cholesterol probably is not the culprit of why cholesterol is up. It's usually probably glucose, carbohydrates. But the point there is, it's something that the patient is seeing in themselves not being able to control. And as I mentioned to you a while ago, when you are on a statin, you have nutrient depletion. So I replace this for my patients, like CoQ10, vitamin A, D, E, K, and all these omegas that I also give with along with the statins. So with those are the supplements that I do, but also in the IV realm, we also give them chelation therapy, plaque X. So all of these are assistive IVs in relation to cardiovascular health. And nothing beats, as I always tell patients, the three pillars of cardiovascular intervention: diet, lifestyle, and exercise. Even I say, hey, if you're not on a statin, if you're not going to do IVs, if you're not going to do supplements, these are the three pillars of cardiovascular intervention. So nothing beats those in terms of management.
Okay. As usual, we appreciate your input and your experience on treating this problem. So thanks for being with us.
Well, thank you, Steve, for having me. As we all know, knowledge is power, and thank you for letting me provide you with edge and longevity and health maintenance, which I call the biological edge or the bio edge.